This is an informational video to talk about colonoscopy and flexible sigmoidoscopy procedures. Both colonoscopy and flexible sigmoidoscopy procedures are camera tests of the large bowel. This is a procedure where a long, thin, flexible tube with a light source and a camera on the end is inserted into the rectum to examine the large bowel. The scope is moved around the bowel until it reaches the end. We know we have reached the end when we can see the appendix. This is when the endoscopist who is performing your procedure will slowly start to remove the scope and carefully examine your bowel as they do so. You may have been referred for a colonoscopy or a flexible sigmoidoscopy procedure for any of the following reasons. You may have a history of sudden weight loss. You may be experiencing abdominal pain, rectal bleeding, or a change in bowel habit, meaning that you are suffering with either constipation or diarrhea. You may have a positive FIT test, meaning that blood has been found in your stool sample. You might be being investigated for iron deficiency anemia, or may have suspected inflammatory bowel disease, ulcerative colitis, or Crohn's disease. You may have noticed melena, which is where you can see blood in your stool. There may have been an abnormal finding on bowel imaging, or you may have had polyps removed before and are now on a post-polypectomy surveillance program. The purpose of this test is to examine the large bowel to look for any abnormalities. We will take pictures to show where we have been and what we have seen. We will also take any tissue samples that we need to, and we will remove any polyps that we see if it is safe to do so. Some polyps can be quite large and we may need to bring you back for another appointment to remove them. There are risks associated with both colonoscopy and flexible sigmoidoscopy procedures. There is a risk that these procedures can sometimes cause pain or discomfort. The endoscopist will put air into your bowel to help move the scope. If you hold on to this air, it can become uncomfortable. It is important to release this air as and when you can. The options for pain relief for your procedure are Entonox, which is also known as gas and air. This can be inhaled as and when you need it and is out of your system within 30 minutes, meaning you will be able to drive and go about your day as normal. The other option is conscious sedation. This is a mixture of midazolam, which is a sedative, and fentanyl, which is a strong painkiller. Midazolam can make you forgetful, so it is important that you have a responsible adult to pick you up and stay with you for 24 hours after your procedure. If you choose to have sedation, there may be complications. We do keep drugs to reverse the effects of the sedation if needed. Other risks include a failure to complete the procedure. This means that for whatever reason we are unable to get all the way around the bowel. It is not uncommon for us to ask you to change your position during the procedure, as this allows the bowel to lay differently and can make it easier to move the scope. We may miss some pathology. This means that sometimes we may miss small polyps hiding in the folds of the bowel wall. The scope is removed slowly to allow us to carefully look at the bowel wall, so it is uncommon for us to miss polyps. There are some bigger risks, which are rare. There is a risk of bleeding, which may require a blood transfusion. You will be asked on your consent form if you would be willing to consent to a blood transfusion should you need one. There is also a risk of a perforation or a tear to the bowel wall. This may require surgical intervention. Whilst these are rare risks, it is important to be aware. Once you have signed your consent form, you should also be aware that you can withdraw consent at any time, and should you wish to withdraw consent, we will stop the procedure as and when it is safe to do so. Both colonoscopy and flexible sigmoidoscopy procedures are gold standard tests, as we can get direct views of the bowel wall and can take samples if needed. However, there are alternatives to having a colonoscopy or a flexible sigmoidoscopy. These alternatives are having no investigation at all or having a CT scan. However, you may still need a colonoscopy even if you have a CT scan, in case there are any abnormal findings, which is why you will be referred for a camera test in the first instance. To prepare for your procedure, you will need to take bowel preparation to clean out your bowel. This is to ensure that we can clearly see the bowel wall for any abnormality. If you are having a colonoscopy, this will be oral bowel preparation. If you are having a flexible sigmoidoscopy, this will either be an enema or oral bowel preparation. The reason for your procedure will determine which bowel preparation you need. The instructions on how and when to take your bowel preparation will be included with your bowel preparation package. These instructions can also be found on the CHFT endoscopy website. You will need to collect your bowel preparation before your appointment. Prior to starting your bowel preparation, you should undertake a 3-day low-fibre diet. This allows the bowel preparation to be as effective as possible in cleaning out your bowel. 3 days before your procedure, you should start avoiding foods high in fibre, such as fruits, vegetables, whole grains, nuts, and seeds. On arrival at the endoscopy department, on the day of your procedure, you will meet an endoscopy receptionist who will ask you to confirm your name, date of birth, and the first line of your address before asking you to take a seat. The time on your appointment letter is the time we would like you to arrive, not the time of your appointment. You should expect to be in the endoscopy department all morning or all afternoon, depending on the time of your procedure. If there is anything you would like to discuss confidentially, please inform the receptionist. From the main reception area, a member of the nursing team will collect you and take you to an admission room. Here, they will ask you to confirm your name, date of birth, and the first line of your address. In here, the nurse will check your pre-assessment form and your medical history and will also check your blood pressure, heart rate, oxygen levels, and your temperature. The nurse will go through your consent form and answer any questions you may have. You will be asked to change into a theatre gown and dignity shorts. If you are having sedation, we will put a cannula in your hand or arm at this point. During the admission process, we will discuss your consent. You will be sent a consent form for your procedure through email to read. There are links which include further information regarding your procedure. It also includes the risks and benefits of your procedure, options for pain reliefs, and the alternatives to your procedure. It is important that you read this form carefully, and if you have any questions, the nurse admitting you for a procedure will go through these on the day. After you have discussed the risks and benefits, signed your consent form, and the nurse has completed your admission, you will be taken into a smaller waiting area to wait for your procedure. There are toilet facilities in this area. There are 3 endoscopy theatres that are all undertaking different procedures. This means that patients who come into the waiting room after you may be going in for their procedure before you. It is advisable to bring something to read and ensure your phone is fully charged. The nursing staff aim to keep you updated on your waiting time regularly. A member of the nursing team will collect you from the waiting area and will take you to the endoscopy theatre. They will complete a safety check, which means that they will again ask you to confirm your name, date of birth, and the first line of your address. This is to ensure that we have the right patient for the right procedure. Once the safety check is complete, you will be asked to lie on the trolley on your left-hand side with your knees towards your chest. If you are having gas and air, you will be shown how to use it before the procedure starts. If you are having sedation, you will have an oxygen mask placed over your face, and then the endoscopist will administer the sedation. The sedation is conscious sedation. It won't make you fall asleep, but will help you relax. The endoscopist will start with a finger examination of your bottom to make sure it is safe to enter the scope. The scope will then be inserted. After your procedure, you will be taken into the recovery area. In here, we will check your blood pressure, your heart rate, your oxygen levels in your blood, and your temperature. We will give you something to eat and drink. If you have had sedation, we will contact the person who will be collecting you to inform them of what time you will be recovered and what time you will need collecting. We will give you a copy of your report, explain the findings, and then give you your discharge information. If you would like someone with you when you are getting your discharge information, please inform the nursing team on admission. You now need to complete the pre-assessment form that follows this video. Once completed, the endoscopy team will review your answers. If no further action is needed, you will be sent your consent form to read and a text message informing you of when and where to collect your bowel prep. If we require further information or need to give you advice regarding any medication that you are taking, we will contact you by telephone or invite you for a pre-assessment appointment, which will take place over the telephone or face-to-face if necessary. If you have any questions or concerns about your procedure, please call the endoscopy department on 01484 355 868.